Hi, I'm Dr. Bala Kranthi, Clinical Head Jiva Rehab. So, what is post-stroke rehab? What happens after stroke? What does rehab mean? What do we do in rehabilitation? So, let me see what is stroke. After stroke, what happens to the patient? The brain has an inherent capacity called neuroplasticity. So, this neuroplasticity is a broad term when we speak about recovery, but it acts in the brain in the background to recover from the damage caused to the brain by the stroke. But the neuroplasticity requires a proper guidance. If it is not properly guided, the recovery is not fast. That is when rehabilitation comes in picture. That is when you need physical therapist, occupational therapist, speech therapist. So that is when Jiva Rehab comes into picture. So what generally happens in stroke? Post-stroke, patients develop few common conditions. There may be a loss of sensation or loss of a motor activity due to the clot in the brain. So, a hemiplegia. Hemiplegia is nothing but a loss of one side of the body. Quadriplegia, it's a loss of four limbs like motor activity or sensory activity. Then aphasia is a loss of speech. These are the things which generally people develop after post-stroke. So what we do and how do we recover the patient with the advanced technology now, there's something called electrical stimulation. We use electrical current to stimulate the lost sensation, the lost movement in the body. Then we start NDT techniques, the neurodevelopmental techniques, in a proper Bobath approach on a Bobath couch. These are manipulations done with hand by a physical therapist to mobilize the patient, to get back the lost movement of the patient. Then we start stretching the tightened muscles. What are the muscles tightened, contractures? We break them and we start stretching all the muscles of the body wherever there's a lot of tightness. Then post that we start strengthening the limbs. All strengthening activities with equipment called TheraBands, resistant bands, so weight cuffs, the sandbags. With all these, we start strengthening the limbs. Then, post that, the physical therapist starts making them walk the gait pattern. It starts training them on the gait pattern, the walking pattern. There's a loss of walking pattern. The patient doesn't walk properly. So that is when he trains how to walk and all. Post that, the occupational therapist will make him train on the higher motor skills, the grip, the fine grip, holding a pen, holding a needle, like a simple activity he does at home, buttoning up the shirt, removing a bolt of the door, or any other activity which he does in the daily life. This is done with the pegboard activities, the all pegboard activities where we have all this equipment where we do these activities. Then speech therapist comes in, he tries to get back the loss of speech, the speech which is lost by doing some exercises, the facial exercises and all, and they try to get back the speech. So this is how the whole rehabilitation is done. The physical therapist, the occupational therapist, with all the equipment, the advanced equipment we have, we perform all the manipulations and then try to get back the patient to the normal life. So we at Jiva make this magic happen where a bedridden patient walks out on his legs from this gate. So that is why we call this as incredible healing. Thank you.